Good day, everyone. This is Chahin Mongala, and we are going to tackle. We're going to tackle the topic bandaging and splinting. Welcome to Module 10 of NSTP1. Module 10 will tackle these topics: bandaging material according to use, bandaging material, bandaging technique, triangular bandages, four-tail bandage, bandage rolls, bandaging methods, upper limb bandaging, and lower limb bandaging. At the end of this module, we will be able to identify the use of all types of bandaging materials and select suitable bandaging according to its purpose. Number 2, explain the desired effects of the bandaging. Number 3 is differentiate various types of bandaging materials. Number 4 is demonstrate different bandaging and splinting techniques. And number 5, apply these techniques in real-life situation. Introduction. The proper bandage, properly applied, can aid materially in the recovery of a patient. A carelessly or improperly applied bandage can cause discomfort for the patient. In many instances, it may expose the wound to danger of infection. It may even imperil the life of the patient. It is essential, therefore, that all personnel of the Army Medical Service become familiar with the various bandages and be able to apply properly. This module on bandaging will aid the student, but the technique of bandaging can be mastered only by constant practice. This is from the Bandaging and Splinting 1957. It's a book. Bandaging is an important part of nursing care and treatment in every healthcare facility. Properly applied bandaging must meet its purpose and fulfill the aesthetic criteria. It must be applied so that it does not restrict but is not too loose. If administered to an open wound, both the dressing and the bandage must be sterile in order to prevent infection. What is the bandaging material according to use? Number 1 is the protection. Protects the wound from the cold, impurities, secondary infection, for example, the gauze square, gauze bandage, plaster, and etc. Number 2 is compression. Pressure of bandage used for bleeding. Compression of vascular injuries, also included in this category, are elastic bandages, compression stockings, leg bandages, gauze bandage, triangular bandage, or for the first aid. Number 3 is fixation. Fixing materials are applied to strengthen the bones and joints. For example, a broken bone. Included are adhesive plaster, starch bandage, plaster bandage, etc. Number 4 is supporting. Maintains a particular part of the body in the desired position. Like for example, there's an injury, paralysis. For example, start using paste, bandage, and splints. Number 5 is extended wear. A stretching aid attached to compensate for the shortening of the limb caused by a broken bone or by damage to a joint by pulling the counter movement. So there's a splint, plaster bandages, specific aids device with pulley and weights. Number 6 is redressing. Redressing is a corrective for the corrective aid attached to the affected part of the body to facilitate a gradual change in the shape or growth in another direction. Used mainly in pediatric or orthopedics. So it's used mainly in pediatric orthopedics. Bandaging material. The common dressing material is a fabric such as cotton, flax, but also synthetic and elastic fabric materials. Some materials are solid, others are adhesive, or can copy the physiological shape of the human body. Triangular bandage. This is the simplest dressing aid, most often used in first aid. It is made of cotton fabric or calico bandage or bandage from non-woven fabric for single use. Hydrophile gauze. Fabric with a high content of natural fibers, approximately 70% cotton and 30% viscose, for example, ensures high absorbency. The fabric is used in the manufacturing of bandages, gauze squares, tampons, gauze drains. Bandage rolls. There are rolled strips of fabric produced in width of 3 to 30 cm. Hydrophile bandage, hydrophile gauze. This is used to cover wounds. The sterile form are used as individual wounds dressing. The bandages are light and permeable. Flexible elastic bandages. So flexible elastic bandages, these can be divided into cohesive bandages. Bandages with a minimum or with a medium compressive effect and bandage with a strong compressive effect. Cohesive bandages contain a high percentage of natural fiber and are impregnated with latex, which provide good cohesion. It is used to dress the joints and conical body parts. Bandages with a medium compressive effect and bandages with a strong compressive effect are used to attach a supporting dressing to injuries, where there is damage to the musculoskeletal system. To attach a pressure bandage for bleeding and also in sports bandaging. Fixing bandages. This is hydrophile bandages impregnated with a firming agent to reinforce the bandage. Zinc paste bandages. These are impregnated with a special paste. When attaching these bandages, it is necessary to take into account that they contract during drying. Therefore, they should be attached loosely. Their surface is sticky, so the bandaging must additionally be covered with hydrophile bandage. Starch bandage. These are made of stiff hydrophile gauze, impregnated with wheat, potato, or rice starch. They are wrapped on a strip of paper and stored in a dry place until application. They are used to strengthen the joints in minor injuries. Before use, the bandage must be thoroughly soaked in hot water until the water penetrates all the layers. Then wrung dry before application. The starch bandage is applied over a cotton wool dressing attached with hydrophile bandage. Plaster bandages. These are impregnated with plaster. They provide reliable fixation of the broken bone. It is the hydrophile bandage which is impregnated with a fine plaster. The bandages are wrapped in a moisture-proof packaging Moisture would harden the plaster and the bandage would be spoiled. Before use, the bandage is soaked in 40 degrees Celsius hot water. The bandage is not moved at this point so as not to spill the plaster. Then, it is removed and gently wrung and then immediately attached. Attaching requires experience as it must be done quickly. The time of molding the bandage is short, 2 to 3 minutes. Elastic sleeves and elastic mesh bandages. Elastic sleeves, for example, stolpa or Raucott tube. Suitable for fixation, attached to cover the wound. Also suitable as a dressing and as a sleeve for starch, zinc paste bandages, and plaster bandages. Elastic mesh bandage, for example, Provan, Raucott Flex, used for fixation and protection for various types and sizes of wounds. The bandages are flexible, do not slip or stretch. They are made in sizes 6 to 9. They come in sizes suitable to attaching to a finger to sizes suitable for bandaging the chest. Compression. Gauze compression bandages, for example, Sterilox ES, is made of hydrophile gauze. They are absorbent, soft, and permeable. The advantage of protecting the wound with a gauze compression bandage is that it is stick to the wound with hurts. They are made in different sizes, multi-layer absorbent compression bandages. For example, Bespon, Santin, Steripore, and Cosmopore. So the multi-layer absorbent compression bandages have an especially adapted contact layer that ensures painless removal and allow drainage of secretion into the absorbent core. The reverse side does not leak the secretion. Like for example, it prevents secondary contamination. Special compression bandages. For example, Sorvalgon, non-woven compress made of calcium alginate fibers. Tender wet dressing with absorbing polyacrylate element or the activate with Ringer solution. It is used to treat infected wounds and is difficult to access in deeper layers. Hydrocolloid compression or hydrocol hydrosorb. This is a self-adhesive with a gel pad core. They are made in different shapes and sizes. These are used to protect large wounds, accelerate the process of granulation and epithelialization. They are suitable for the treatment of chronic wounds. You can see the chapter on wound dressing, and they are easily be removed. The advantage of their transparent foil is that the wound can be checked without having to change the dressing. The compression is replaced as needed according to the wound secretion. Compression with ointment, for example, Outroman, Grasolin, are made of soft Tylexol, which is impregnated with active substances. The ointment base is permeable for the secretion. Therefore, an extra suction layer is needed. For example, it is used in burns. Cotton wool is a fiber. It is made of cotton or cellulose. This is a type of cotton wool products. So there's a type of cotton wool products like for example, there's a medical cotton wool. Medical cotton wool is made of cotton fibers. It is used in the manufacturing of cotton buds. or it is a part of other absorbent material such as gauze, square, and hygiene products for incontinent patient. It is also used to base material under plaster and splints. Cellulose wadding. It is made from cellulose. It is used in many nursing interventions. It is absorbent paper rolls or in various size square. Depending on the use, it is also made in the form of perforated strips which are later separated into individual squares. Plaster. Plasters are used to reinforce bandages. They are made of woven and non-woven fabric, which is coated with rubber resin or with non-irritating polyacrylate adhesive. They are applied to dry and clean skin. Their most common use is in the fixation of bandages, probes, and peripheral cannulas, and etc. Traditional plasters. These are made in skin-colored strip with an adhesive layer of rubber resin. They are very sticky, difficult, and painful to remove from skin. They are made in widths of from 1.5 to 30 centimeter and can be perforated. Artificial silk plaster. Solid fixation patches made of artificial silk with strong adhesion. They are used in patients with sensitive skin and are porous and water vapor permeable so that the skin can breathe. They can be used to attach probes, cannulas, and catheters and for fixation of all types of dressing. They can be easily removed and do not leave unwanted adhesive residues on the skin. Plaster made of porous and transparent foil. These are the plaster made of porous and transparent foil. These are hypoallergenic, porous, and transparent, suitable for fixation of all types of dressing. For transparent fixation of cannulas, probes, catheters, etc. They are also suitable for patients with sensitive skin. Plasters from soft non-woven material. These are porous and water vapor permeable. The skin can breathe and does not sweat. They are ideal for patients with particularly sensitive skin. They do not cause maceration even with long-term and large area fixation of dressing. The wound can be protected against external moisture with omnipore hydrophobic impregnation. So the omnipore is the hydrophobic impregnation. The plaster can be used both crosswise and lengthwise. Non-woven elastic plaster. These are used for large extra fixation of wound dressing. So the non-woven elastic plaster, these are used for large area fixation of wound dressing. Their advantage is the easy and trouble-free use on curved and conical parts of the body. Padded plaster made of non-woven fabric are used for treating minor injuries. They are produced in the form of strips which are cut as needed or are supplied as individual patches. Compression elastic bandages. These are compression or constricting bandages, which are attached for the treatment of venous conditions in the lower limbs and often for heart failure. Elastic bandages are also used to support the muscle in the lower limbs. thereby supporting and improving venous blood return. There are ankle, calf, and thigh bandages. Also available are glove-type bandages and shoulder sling bandages. They are produced in three compression classes. Number one is the weak compression, attached to subjective complaints. Number two is moderate compressions, used in chronic venous disease. And number three, strong compression, mainly used for significant swelling. The bandage is attached in the morning before the patient goes out of bed. An elastic bandage can be used to bandage a leg from the toes upward. The bandage created compressions should be strongest at that ankle and gradually abates toward the knees. Splints. Splints are used for fixation of bones and joint injuries. They are made of materials in various sizes. Number one is air splints. These are mainly used in first aid for the fixation of the arms and legs. They are made of plastics. The air splints are applied like a double sleeve of trousers and filled with air. Number two is thermoplastic sectional splints. These are used for the fixation of small bone fractures in limbs. They are heated in hot water or by air at 70 to 90 degrees Celsius for approximately 1 to 2 minutes and molded into the desired shape for about 1 minute. The splint achieves the desired fixation shape after 5 minutes. Other types of splints are made of lightweight, perforated but strong materials with various modifications, such as lengths and positions. Orthoses. Bandage and non-bandage type of orthoses are used for the fixation of body parts. Bandage type of orthoses are made of neoprene. They can be in the shape of a sleeves, reinforced with plastic or metal splints. Blocking, bending, or not blocking, bending. Some types have adjustable setting of the bending. Non-bandage orthoses. These are made of plastic. They are divided into fixation or immobilizing and redressing remedial groups. Fixation orthoses are used in bone and joint injuries. Neck orthoses have a shape of the collar like a height adjustable. The Salt's bandage is attached in broken collarbone and shoulder joint injuries. Redressing orthoses. These are used in orthopedic defects like the toe, leg out of position. And in contractions, shortening of tendons. Orthoses that are attached to the torso are designed to support and stabilize the spine, or as an after treatment of spinal fractures as relief for osteoporosis and in the treatment of scoliosis and kyphosis. Bandaging techniques. There's a general principles for bandaging. Number one, explain to the patient the reason of the method of bandaging. Number two is ensure patient comfort, like toilet visit, comfortable position, and for example, sitting down or lying on the bed. Number three is respect the patient physiological abilities. Number four is ask the patient to participate. Number five is ensure the patient's dignity. Number six, if possible, always face the patient during the course of bandaging. Number seven, maintain constant contact with the patient Monitor their conditions. Number 8, prepare the aids with reach near the patient. Number 9, put the part of the body that will be bandaged into a position that is the closest to the physiological position and ensure that this position will not change during bandaging. Number 9, sometimes it is necessary to move your body hair or cut the hair on the head. The skin must be clean and dry before bandaging. Number 10, apply rolled up gauze or cotton wool to prevent intertrigo in areas where 2 layers of skin touch, like armpits, under woman's breasts, etc. Number 11, before bandaging, the wound is first protected with sterile material. Number 5, select the appropriate type of bandaging in terms of size. Number 13, during bandaging, the bandage roll is firmly held in the dominant hand while it is unrolled into the palm. Number 14, the bandage is first secured with a spiral turn. The end of the bandage is folded under the second turn. Number 15, the bandaging always starts at the narrowest point and proceeds to the widest points upwards, towards the heart, except for the hand and toe bandaging. The next turn overlaps the previous turn by about 2/3. Number 16, the turns are always in the same direction. Number 17, the bandaging finishes with a spiral turn and a lock, or it is secured with plaster tape, always outside the wound. Number 18 or 17, the turns should not be too tight or too loose. The complete bandage is effective and neat. We have here the triangular bandages. Triangular bandage is the easiest dressing tool. It is used to create fixation, compression, protection, and support bandages. They are primarily used in first aid due to their easy and quick application. The triangular bandage is a 3-pointed scarf made of calico or non-woven fabric. The bandage can be folded to create a bandage strip, then the so-called cravat. The ends are tied with a flat knot to avoid pressing. Head bandage. The triangular bandage border lies over the forehead just above the eyebrows. The ends are passed around the sides of the head just above the ears and cross over at the point of the bandage at the back of the head. The ends are brought forward again and not over the center of the forehead. The tip of the bandage hanging at the back of the head is tucked under the crossed edges of the bandage. Hand bandage. This type of bandaging is used to protect the wound. Full hand bandage. The triangle bandage is placed on the table, the finger being towards the point. The base of the triangle is below the wrist. The hand is placed on the triangle. Bring the point back over the hand to the wrist, then bring the end over the back of the hand and cross them over to the point. Wrap them around the wrist, cross at the front and not over, point behind. Shoulder bandage. 2 triangular bandages are needed. One triangle is laid on the table and the second triangle is laid over the first one, so its point is approximately in the lower third of the bottom triangle, like for example 10 centimeters from the center. The bottom triangle is rolled from the tip of the top triangle, thus the prepared bandage is placed on the shoulder. The shorter end of the bandage is in the direction of the sternum, at the front of the chest. The base of the second scarf is wrapped around the arm and both ends are tied on the outer side of the arms. Lower limb bandages. These are used as protection and fixation bandaging. Foot and instep bandages. These are attached the same way as the hand bandages. The ankle or talus bandage. This is attached as a first aid to strengthen the ankle. The foot and leg are at 90-degree angles. A large 4-point scarf is folded to create a 3-point scarf and then further folded into 13 to 14 centimeter wide cravat. The cravat is placed under the heel with the top of the strip overlapping the Achilles tendon. Both ends are crossed at the front. Then, outer end of the cravat is brought over the inner ankle on the heel and attached to the top of the strip. Another end is brought over the instep, once again over the outer ankle and over the Achilles tendon to the front. The end from the inside is brought under the foot and on top of the instep. The ends are tied into a knot. It is fixation bandage, so it should be as firm as possible. Knee bandage. It can be attached as a covering or fixative. The scarf is folded into wider cravat. The center is placed over the knee at the front. The ends are crossed below the knee. One point attaches the cravat above the knee calf, the second below. Both ends are again crossed under the knee, again and tied into a knot above the knee cap. Hip bandage. The hip bandage is similar to the shoulder bandage. The triangular bandage is folded into cravat and attached at the waist. The second triangular bandage is used to cover the hip. The ends are brought around the thigh and tied on the outer or at the front into the knot. Four-tail bandage. Some parts of the body, such as the chin and the nose, are difficult to attach a bandage. These areas are treated with four-tails bandages. This bandage is prepared from a strip of hydrophile gauze which is split into two on both ends. These ends of the resulting strip are knotted on both sides. The part that has not been cut forms a pocket. Four-tail nose bandages or bandage. This is most often used for bleeding from the nose or after nose surgery. It is prepared from a 6 centimeter wide bandage. A strip is cut off and adjusted. The middle, uncut part is placed over the nose and the bottom strips are brought over the top of the ear and tied at the back of the neck. The upper strips are brought below the ear to the back of the neck where they are crossed and tied into a knot. Four-tail chin bandage. It is attached after chin treatment. It is attached in a similar manner as the four-tail nose bandage. Bandage rolls. These are the most commonly used of bandage in clinical practice. Attaching bandages is more challenging. The bandaging technique is based on a turn, for example, wrapping the bandage around the body part. Bandaging methods. We have these circular turns. The bandage is applied in a series of overlapping circular turns. This technique is used in minor wounds. Spiral turns. This technique is used on the body parts that are narrowing or widening, such as limbs. Each subsequent turn partially overlaps the previous layer, proceeding upwards. Open spiral turns. The technique is a series of turns that do not overlap or are spaced out. This technique is used to attach splints or as a dressing layer for a bandage. Figure of 8 turns. This technique is used for bandaging some joints. The figure of 8 technique is a series of spiral turns applied in alternate directions. Spica bandage. The spica is a series of figure of 8 turns, where each turn overlaps the other. The spica bandage is usually applied in diverging manner, like for example, the divergent spica, or in converging manner, for example, the convergent spica. So we have this divergent spica, or converging, the convergent spica. The spica bandage technique is used to bandage cylindrical body parts. What is divergent spica? Divergent spica is the technique is applied in below. So what is divergent spica? This technique is applied in elbow, knee, and heel bandaging. The first circular turn goes over the flex joint, followed by figure of 8, turns away from the center. The turns overlap the more central one. Number 2 is convergent spica. The first circular turn goes under or above the joint. This is followed by figure of 8 turns, where each turn overlaps the one further from the middle. The last turn is brought over the joint. Each bandaging begins with the loose end placed diagonally in the bandaging direction on the body part, followed by an overlapping circular turn. Upper limb bandaging. A large number of upper limb bandaging consists of protection bandaging. Upper limb bandaging uses bandages that are approximately 3 cm wide, used for the fingers and the back of the hand, and with 6 cm wide bandage used for the arms, and an 8 cm bandage used for the shoulder. Spica thumb bandage. The bandaging starts with a circular turn at the wrist, then a turn across the hand and around the thumb. If the thumb needs to be covered, the bandage is folded over the tip several times. The thumb is bandaged using the Prof. Knobloch technique, also known as the thimble, and secured with a circular turn. The bandage is then applied in the opposite direction from the outside of the wrist. The figure of 8 turns are repeated, with each turn overlapping the previous one. The bandaging finishes at the wrist. If it is not necessary, the tip of the thumb is left there. Spica hand bandage. The bandage is applied in a divergent manner. The tips of the fingers are bandaged with a circular turn. The second turn crosses the back of the hand towards the thumb, which remains free. This is followed by horizontal turns across the palm. The turns continue to cross the back of the hand up to the tip of the little finger. The back of the hand is entirely covered with spica turns. Full hand bandage. The bandaging begins across the palm, from the wrist to the fingertips, over to the back of the hand and the wrist. The bandage is folded and held with the other hand. The next turns alternate from the center of the hand to the side so as to cover all the fingers. The bandage is secured using circular turns at the wrist. The bandaging continues with a figure of 8 turns from the wrist, diagonally across to the back of the hand, horizontally across the palm, under the thumb, and diagonally across the fingers to the top. The turn is led horizontally and the bottom side of the fingers and then diagonally across the back of the hand. The thumb remains free. The procedure is repeated until the bandaging is complete. The bandaging is completed with the last circular turns at the wrist. Finger bandage. A circular turn is made around the wrist and then over the back of the hand towards the finger furthest away. Right hand to the top, left hand to the little finger. This is followed by a spiral turn to the fingertips, which is covered with several folded layers. And then across the back of the hand, the direction is the opposite of the previous one, and this is followed by a turn around the wrist. The same technique is used to bandage the next finger. The bandaging is secured at the wrist. The palm remains free. Forearm bandage. The bandage is applied in an ascending manner. A circular turn is made around the wrist, followed by overlapping turns or reverse spiral turn. Elbow bandage. The elbow band is bandaged using divergent or convergent figure of turns. Ascending social bandage. Again, ascending shoulder bandage. The bandaging also includes a dressing, like for example, gauze square or cotton wool. A circular turn is made at the upper third of the arm. This is followed by a turn which begins on the outside of the arm, goes across the shoulder, and then back under the armpit of the unaffected arm. Powdered cotton wool or gauze rolls are placed under the armpit to prevent intertrigo. The bandaging continues across the chest towards to the treated arm, under the armpit, and again across the shoulder, and then back to the opposite armpit until the entire shoulder is covered by the bandaging finishes with a circular turn around the shoulder. Lower limb bandaging. Use of protection and fixation bandages. A 3 to 4 centimeter wide bandage is applied to the toes. A 6 centimeter bandage is applied to the heel, and 7 to 8 centimeter wide bandage is applied to the lower leg. The 12 centimeter wide bandage is suitable for hip bandaging. Foot bandage. A circular turn is applied around the instep closer to the root of the toes. Then diagonally across the instep above the ankle. Over the Achilles tendon and around the second ankle. Diagonally over the instep where the turn crosses. The bandaging why it's blue? Where I am? Okay, the bandaging continues around the sole of the foot. This is basically the figure of a turn, which subsequent turn in place a bit higher until the instep is completely covered. The bandage finishes around the ankle. Heel bandage. A hydrophile gauze is used as a dressing and is fixed with an elastic bandage. The technique used in this case is divergent spica bandaging. The first turn is across the center of the heel, followed by turns toward the center until the entire heel is bandaged. The bandaging is finished with a circular turn above the ankle. Leg bandage. A leg bandage is one of the most frequently used. It is done to prevent venous thromboembolism. So, venous thromboembolism. Compression bandages or compression bandage. It is tightly applied around the perimeter of the leg so that the pathological dilated veins narrow down again, so that the venous flap can close again. The venous blood flow is increased and the blood return to the heart is normalized. Reason for applying a compression bandage. In the perioperative period, after vascular surgery, to prevent blood clots, for example, in long-term bedridden patients, varicose veins in the lower limbs, prevention of edema. Effects of a compression bandage. Number 1, increase venous blood flow or prevention of thrombosis. Number 2 is strengthening of vessel walls. Number 3 is narrowing of dilated vessels. Number 4 is support for calf muscle. The venous valves function better. The contraindication of the compression bandage application is usually the disease in the lower limb arteries. Some heart disease, for example, left heart failure, the compression could cause insufficient blood flows to the limbs. So we have this glossary. Cravat. A bandage made by folding a triangular piece of material into a band, used temporarily for a fracture or wound. So we have these references and supplementary materials, nursing procedures and intervention by Hlavakova Marie et al. Facultini Nemokchine v Motole, Česká republika, 2014, ISBN 978-87347-164. So we have this also, the Bandaging and Splinting, 1987 by fast.org. That's all for today for our topic, Bandaging and Splinting. Maraming salamat po sa pagsama sa akin at magandang gabi. Paalam na po.